So welcome everybody to the research seminar series. Today we welcome Professor Victoria Traynor. It's not often that we get to talk about unicorns and magical beings and health, but today Victoria is going to talk to us about her work developing a gerontological workforce and finding the unicorns. Welcome, Victoria. Thank you.
There we go. Thank you. Okay, good afternoon, everybody. I'd like to start with an acknowledgement of country. And the acknowledgement of country that I'd like to share with you is about our ripple effect. This image here on the slide is from the Gerontological Alliance of Nurses Australia and was created for us by Crystal Langford, who's a Wiradjuri woman. And this painting is called Ylang, which is about the ripple effect. And she created this painting for us when we explained what the purpose of our association is and the challenges that the gerontological workforce face. And we talked about how we want to make a really big impact. And so she drew this beautiful painting which conceptualized ripples and the ripple effect we have. And when we do our work, we try and support the workforce to think about that ripple effect. If it feels challenging, think that one small thing that they do with the older person, with their team member or their family member, will reach far and wide and much further than they can see their impact is having. So what's my background? I've said here I was a unicorn from the beginning. So I did volunteer work at high school in an acute aged care ward. Now you can imagine I was the only one who picked that, but here I am, Professor of Healthy Aging. So I was, it really was my passion from being a young person, visiting all my old aunties, and I just loved listening to their stories. And in my previous job, I established a research centre, and I've identified here that it grew from small grants and industry collaborations, because maybe it's like the ripple effect as well, that you just keep pushing forward. Small progress can actually lead to larger things. Now, here in the Sunshine Coast, we've got a healthy aging research cluster that has about 50 members and goodness knows how many industry collaborators. So I'm just so happy to be here. And these 4 unicorns in the room are just 4 of other team members that I've had in the past. I called them fellow unicorns, and we recruited them from clinical practice and graduates from our master's degrees. And when I say from clinical practice, it's a lot of the research I do is with industry partners, and I would, identify those team members who had that spark, had that passion, and slowly over time chit chat to them, and the next thing is they're doing their PhD. And the first success story was Lauren DeVries, who was a registered nurse in an acute medical ward in our local hospital. She's now the senior managers for serious incident reporting in the Aged Care Quality and Safety Commission. So she's got a nationwide job. And along that journey, she also became a nurse practitioner, but never did her PhD. But we won't hold that against her since she's doing such brilliant work. And the national animal of Scotland is the unicorn. Who would believe it? And this is a day at Stirling Castle that's held every year when the unicorns come together and do a bit of jousting. And if you don't believe me, the unicorn is actually on the national coat of arms for Scotland with the lion rampart. So it's true. That's why we're finding the unicorns. So I just wanted to give a little bit more of the background of me, because my professional background and the work that I've done are quite interwoven. So I've already mentioned the Gerontological Alliance of Nurses Australia. And myself and my colleague at the University of Canberra are the co-presidents, and we're the founding presidents. And I've got this photograph of the armed services going into nursing homes during COVID. And when that happened, it was really a motivator for myself and Kasia, because we just decided that we had to be the ones that did something. And so we've established Ghana, and a lot of the work we're doing is through the membership. And some of the grants that we've been awarded since establishing Ghana have actually come from us setting up Ghana, because the chief nurse has recognized this is a really important area of work that needed some leadership. There we go. Just to remind you about the Healthy Aging Research Cluster at University of Sunshine Coast, and that we actually are an age-friendly university. And that was only awarded, Tricia, was it the end of last year? Yeah. So we haven't, we're just moving forward in what that looks like in reality, but the Healthy Aging Research Cluster will be focusing on that in the future. And you'll probably be aware we've got a graduate certificate. Currently it's called Aged Care, but imminently it will be reframed, and it's going to be the graduate certificate in gerontology to make it more contemporary and increase the enrollments and the impact we can have with that graduate certificate, you know, and grand plans to lead into a master's as well. So what are the strengths of the aged care workforce in the community and residential aged care? So that the gerontological nursing workforce is in community, it's in acute care, it's in residential, but today I'm going to focus on community and residential. Their passion for person-centered care is really clear. And Mia yesterday and Nina spent the afternoon at Emmanuel Gardens and came away just beaming because of the experience they had. And Mia used the words about the love in the heart of the professionals that she met. And for those of you who know Tom Kitwood's person-centered care work, where person-centered care in dementia started, at the centre of that is love. And Mia has felt that in action. There are so many professional development opportunities in residential and aged care for the gerontological workforce because it's very complex. There's authentic interdisciplinary work, and we can't care for an older person in community and residential without really authentic interdisciplinary work, because the older person comes with so many levels of complexity in terms of their physical health, their mental health, and their networks. And we have an ideal scenario for the extended scope of practice. Now, I don't want to be too political, but I was on the edge of my seat on election night because I think that Mark Butler, our Minister for Health, has done so much for nursing in particular. And I think there's more to come for extended practice for physios, paramedics, and so on through this current government. And I hope you like this picture. This is the oldest person in Australia, and he has baked beans for breakfast every day. And Heinz created this 110th birthday present for him with the Heinz beer. I just thought it was great in terms of our longevity. So what are the challenges? So the workforce suffer the challenges of the stigma of aging. So it means it's difficult for undergraduates in particular, or our family and friends, to actually be proud of working in aged care. So the stigma of aging gets sort of put onto them. There's the shame from the Royal Commission. Of course, there was lots of good came out from the Royal Commission, but to think you work in an industry that has had all those inadequacies, cruelties highlighted is really challenging. The acuity profile of the clients has changed dramatically. The amount of ill health that is now in nursing homes has never been seen before, but the workforce is actually not suitable for that. The workforce is the care workers and nurses who haven't had the opportunity to extend their practice, but the clients they're working with, it's like an acute medical ward. It's very fast paced. Not sure if any of you are aware, but for those services that are part of industry, not part of state health, either private or not-for-profit, they don't have access to databases. So it means they can't easily access evidence-based practice. Even if there are some leaders there, the only team members who can easily get access to contemporary evidence are those who happen to be studying. But those in aged care, access to scholarships are not as common as it is when you work for state health. So there's all these inequities. 80% of the team members have English as an additional language. Now, that's a bonus in some ways, because when I teach person-centeredness to our, Southeast Asian registered nurses, they look at me, they're puzzled. And then I look at the ones in acute care and they're puzzled. So the ones that are in acute care are puzzled because they don't know what person-centered is, but the ones from Southeast Asian are puzzled why I need to teach it. So there are advantages, huge advantages, but of course the racism that they experience and sometimes the language barriers are a challenge. And the lack of a medical team. It's in the news every day about the shortage of GPs, and those nursing homes have a real difficulty meeting the medical needs of the clients they look after. And we sometimes hear about older people unnecessarily going into hospital, but when research is undertaken, none of those admissions are unnecessary. It's just what's happened before that has caused it to occur. So, and now we hear terrible stigmatizing terms about older people who are stuck in hospital. And it's like the blame is put on the older person and the nursing home for not taking them back. But it's to do with the shortage of community care and so on. And this is the oldest woman in Australia. And previously, when I wasn't doing fly in, fly out, I had a beautiful garden and I was an avid gardener, so I couldn't help choosing this picture for this lady who's the oldest woman in Australia. What have I done to address these challenges? I've done work over a long period of time to develop competencies for a specialised workforce. Why choose competencies? I've had to rebut the choice of the word competencies instead of standards or whatever I choose. But when we go back to the proper meaning of competence, it captures knowledge, skills and application. And that's why I continue to use the term competencies. But competencies can sometimes be misused and thought of as skills. But competence is much more than a skill. Competencies describe the work required to fulfill a role. So it helps any workforce. It provides detail for position descriptions and recruitment processes. You can actually use competencies to recruit your team members. This might be, in the future. Sometimes it happens. The competencies can inform strategic planning for policies and quality processes. So when you have a competency framework, it can actually become your strategic plan. If you have 5 core competencies, that's 5 topic areas that you can address in your strategic plan. It can also determine the professional development you provide for your team members. Might even help you determine whether somebody receives support to go to an education day, or how does it match up with your competence? How will it help you improve your competence in the areas we've decided are important? So my journey around competencies began in 1998. So I wanted to share some highlights for you. So I found that it was Kathy Freeman was awarded Young Person of Australia in 1998. And I do believe she also won Australian of the Year probably in 2000 or 2001, if it was after the Olympics. And what I read on the internet was that Kathy Freeman is one only person to get Young Australian and Australian of the Year. Then I looked up how many people over 100 there were in 1998. You can see here the UN suggests there was 135,000 centenarians of in the world, and projected to grow to 2.2 million by 2050. So I'm just going to take you through the work that I've done with this competencies development. So the first research I did was with a group of nurses who are Admiral nurses, and the funding was supported by the Royal College of Nursing. And I went there as a postdoc, and I worked with Professor Brendan McCormack and Professor Jan Dewing, and Jan is sadly now passed and up with the stars. But Professor Brendan McCormack is now the Dean of Nursing at Sydney. So it's all these connections. And I did that work in Oxford. And I've got my little red metro there because they told me I had to pass my driver's license to get the job. And everyone in Australia thinks it's hilarious because I was 30. And because you live in Edinburgh, when I was living in Edinburgh, you didn't have to have your driver's license. And I also like the fact that Princess Diana had a red metro. So what I did was I worked with a charity called Dementia UK, and they founded the Admiral Nurses, and then Admiral Nurses are still going today. And I undertook ethnography. So what I did was I would go to their professional development days and I sat in on their client interactions and recorded the work that they did and then talked to them about their aspirations for their work. And it was called action research because then they used the competency framework to inform the recruitment process, the professional development, and how they were going to change their service. And I've got a good news story for you. It's still being used today. So these 6 core competencies, it looks like they've lost 2 of them. I created 8 for them. But the core competencies that I created at that time are still being used by those nurses today. So it's just to, for those of you who are on your PhD journey or those of you doing research and you think it's taken a long time, I'm just going to say rigorous research is really worth it, because if you do a good job, it can be enduring rather than, you know, quick and, you know, fast. And this picture is a picture of the oldest woman in Britain, and there's claims that she's the oldest person alive in any country. So beautiful picture of this lady as well. So next, when I came to Australia, I was still interested in competencies, but I thought, oh, didn't know whether anybody else would be. And you can see it's 2015. I came in 2006. So it was about 2011 I started developing dementia competencies. And this came about just by conversations at a conference. And it was with Dementia Training Australia. And we were talking about how we could uplift the workforce and ensure that they became more competent. And we developed these multidisciplinary, multi-level competencies. So these competencies were tested, developed for physios, OTs, community practitioners, registered nurses, acute care practitioners, and residential practitioners. And we developed these 3 levels: essential, enhanced, and expert. And we created this beautiful image here, and we said that at the foundation, the practitioners needed to develop their understanding of personhood. Then it was about perception of dementia, and then the therapeutic activities that are required to deliver good person-centered care. And that's where the essential, enhanced, and expert grows. So you can see my original, I was in lists, but then I met Nicole, our other team member, and obviously we had brilliant, you know, creativity. Now, neither of us are creative, by the way, but I do love to tell a story, as you have already seen. We had a fire alarm in our office, and we were trying to conceptualize our competency framework, and we had to go outside, and this is what we came with. So whenever PhD candidates tell me they're stuck, I say, just, you need to get outside. Or even my daughter now in year 12, I say, you need to get outside, unlock your creativity. So I've continued the work. The dementia care competencies didn't seem to get as much traction as we truly had hoped for, but we moved on and we got some aged care providers coming to our research group asking for support with to create a competency framework. And underpinning all the work that we do through the undergraduate, the Ghana, through the gerontological nursing competencies and so on, is this vision for a career pathway. In aged care, most of the registered nurses have started as assistants in nursing or enrolled nurses, either by choice of their career or while they're students being an assistant in nursing. So we know that that workforce is, you know, a captive audience for us that we could keep. So a lot of them go on to do their bachelor. And what I'm going to share with you today is 2 courses we've developed: the gerontological nursing competencies, essential and enhanced leadership courses. And we created them so that they could have RPL or advanced standing in a graduate certificate. I already mentioned to you that the workforce in aged care and the community aged care have a challenge getting sponsorship for their graduate certificates. So this really does help them, because we can deliver the course with funding that we've been awarded. And in aged care, you won't find as many clinical nurse specialists as you find in the acute sector. So our work is promoting this vision, because some of the organisations in aged care, they're run by people with business acumen who don't understand the clinical or the career pathways. But when I tell them that to convert someone to a clinical nurse specialist, you only need a few more $1,000 once they've got their graduate certificate, and that person's more likely to stay, we get some interest. So we're slowly trying to enhance that workforce. And of course, then you can go on to do your master's, and after that, whatever type of career you would like to choose. And in my other role with Warrigal, which is an aged care provider, we've actually just converted some clinical nurse specialists to nurse practitioners, because I identified to the management that those clinical nurse specialists could become nurse practitioners in transition without any change in their pay at this point in time. So it'll probably take them 3 years to become nurse practitioners, but they convert them now, and they've given them study time. I've supported them to get onto their master's degree, help them with their scholarship. So they've got a program now, and they're increasing the number of nurse practitioners. So it's when you sort of can present the vision with the business case. So now I'm just going to present the gerontological nursing competencies to you and how we've developed them over several years with the team in the room and Nicole and others. So we started with a literature review. We took the findings of the literature review to a workshop, and then we ran Delphis. We created the competencies, and then we pilot tested them with a workbook. We're all online now, but we pilot tested them with a workbook. And the only thing that we needed to change was that the industry partners wanted a leadership course. So that's why we have the 2 courses, the essential and the leadership one. And then we've got the 2 levels of practice and our competencies. And you can see here we did 5 rounds of consultation. With a snowball. We started with 400 in the online survey, and then went down to 100 plus. But it kept going through, and the endorsement was, the Delphi. You need to decide what minimum level of agreement you'll accept before you keep findings in your research. And we were up at the 80 and the 90% of agreement just following the workshop with those 100 registered nurses. The competencies have been reviewed by a team of First Nations registered nurses working in aged care and education. And so we amended the wording of the competencies and the course to reflect the feedback from the First Nations nurses. And OPAN, the Older Persons Advocacy Network, reviewed the competencies, not the course, but the competencies, and we amended them to reflect their suggestions. So we're very appreciative of the additional feedback there. And we had an advisory group, and we have for the competencies, and we have, I call it a sub-advisory group, which is culturally and linguistically diverse, community represented First Nations, rural providers and so on. And they're constantly giving us feedback about how industry needs are changing to make sure that the competencies and the course stays fit for purpose. So this is a visual representation of our 11 core competencies that we created. And there's also domains of practice that are more specific associated with each of these. And there's the 2 levels. And at the centre, we've got living well for older people across communities and groups. And that reflects the philosophy of person-centeredness. And that's the, the really important core competency. And when the practitioners complete our course, what they do is they generate evidence that they're competent in these 11 core competencies. So our course is not about teaching, for example, wound care or falls prevention. Our course is about providing professional development skills so that those participants, the registered nurses, can demonstrate their competence in the 11 core competencies. So the example I give that makes it clear is about, there's an assessment tool that is recommended in all the aged care organisations and evidence-based practice called the Abbey Pain Scale. And the Abbey Pain Scale is a pain assessment tool that you can use with people with dementia. Everybody knows about it, but when you do an audit, it's rarely being used. So what the participants do is they use that as an activity to actually improve their own knowledge, skills, and then they use it in practice. And the evidence has to include, teaching others or doing the audit and so on. So their portfolio that they produce at the end has got evidence of how they've improved things, but how they've improved other people's practice as well. So in the course, we deliver it online, virtual workshops and so on, with like myself and other team members doing the teaching, but all the participants are also allocated a mentor. So what we found was that because of the profile of the registered nurses working in community and aged care, they needed more than just us teaching them. So they all have a mentor. Most of the mentors will be like 50 plus with 30 years experience in gerontological nursing, and those special skills that a good mentor will have, and they support all the participants. So the funding that we've got includes the teaching as well as the mentoring. And we've got a visual here that the team have provided me at the last minute. Hey, help, can we get the updated figures? So we've delivered the course to 415 participants across 43 different providers in Australia and 89 mentors. The mentors are just fabulous. And of course, we draw them from Ghana sometimes. Sometimes the mentors are internal to the organisation, but in aged care, they haven't got the spare team members. So we have the external mentors. Sometimes team members come and do the course alongside a mentee, and then the next time they can be a mentor on their own. And you can see here the culturally and linguistically diverse participants who complete the course, 68%. And this is just a list of all the different aged care providers who have supported their team members to actually do the course. And sometimes we deliver a whole of organisation cohort. So Uniting and Opal Healthcare, who are two of the biggest providers of aged care in Australia, we've delivered multiple cohorts to them when it's only their team members, and they've provided the mentors. And then sometimes, like the Henry, it's like a small standalone unit. There was only one participant from there. So we've evaluated the impact of the course. So I'm just going to share some quotes with you from the participants and the mentors. So one mentee said, "I felt a bit privileged to have a mentor to enhance my knowledge and expand my vision to move forward in my career." Another said, "There's the assessment form. It's based on the position description. Something could be worked into position descriptions. So at the beginning and the end, everybody does a self-assessment against each of the core competencies." And then one mentor said, "The mentees are feeling more empowered. I think their self-confidence and their self-esteem really improved." And the last workshop that we run is called a celebration event, and the participants share something from their portfolio and where they're going next. And of course, we're all crying, and the CEO's so excited that, they actually invested in this and it's actually worked. They're going, phew. And then the other participant said the outcome is beneficial for the client as well. Person-centered care, good care. So as an educator, you can imagine how happy we are that these are the outcomes, and the rest of the team, all their efforts in the learning design and the administration of the enrolments and so on. We also ran a survey, and the participants said, "The GNCs helped articulate my career path as a gerontological nurse." So it's, obviously really terrific to see that. And then they said, "The GNCs helped guide my clinical role." So this is really important because we're not teaching lessons. We start the course, we say you've all got the knowledge you need, but what we're going to do is to provide you with the skills to put that knowledge into practice. We've done some pre-post matched sample surveys. This has been a huge challenge, getting the participants to complete the surveys, getting the teachers buy-in, even our team members, that this is really important. And we think that perhaps with the participants having English as an additional language, the surveys are, a challenge to get those team members to complete the survey. So we evaluated ageist behaviour. This is where we found significant reductions. So this was a cheer. We had positive trends with dementia knowledge, and we had positive trends with nutrition knowledge and no change in palliative care knowledge. But we'll continue to evaluate as we move forward and see how we can increase the participation rate and do that research. So the portfolios, we haven't analysed the portfolios yet, but that's where we're seeing the knowledge translation. That's where it's just incredible to see what the nurses are achieving. So for example, improving uptake of care directives. So I remember one nurse, she had an incident where an older person was very acutely unwell, and she went to the nursing documentation to see whether this person should be taken to hospital or is they going to stay here, you know, just for rehabilitation and a bit of care. And she noticed, of course, the advanced care directive was missing. So it motivated her to do that as a sort of small project within the course. Inclusive cultures becoming a reality. So, you know, the centre core competency about living well. So one of the common activities that the participant does is either run a rainbow day or they run a day about Italian communities or something, and they have to organise it all themselves and get feedback about the impact of that. The families feeling genuinely involved in care. So when we describe the type of evidence that the participants are required to collect, we emphasise feedback from families, as well as feedback from the older person, but also the families. And the number one error, the number one complaint from the Aged Care Quality and Safety Commission is medication errors. And we're finding that the participants are using the course to tackle medication issues, so medication errors and polypharmacy. And, you know, it's a little bit distressing when you hear the participants have, you know, that awareness raising about medication, but good because the outcome is positive. And of course, for those of you who work in aged care, you'll be well aware about the strengthened standards due to come in on the 1st of July. So our course will ensure that that supports that process by updating content. And we've got Gwen here who's taken on the role as casual with the team to do that task for us. We've had adaptations of the course. So a PhD candidate that I supervised in Australia is from Taiwan originally. So he took the competencies to Taiwan and he ran research, and we got them adapted for Taiwan. And there was very few changes required, quite extraordinary. And then in the Maldives, another colleague is doing some work there. Their plan is that they will recruit mentors. They'll recruit senior gerontological nurses who will become mentors to run the program in the future. So they'll do the program and then they can run it independently. So that's it. You know, it's not about us doing all the teaching. We want it to be self-sustaining. And then some of you here also are involved in this project. So we had the gerontological nursing competencies, and then another opportunity came up to develop enhanced placements for student nurses working in services providing health to older people. And so we drew on the gerontological nursing competencies in a tender to say, if we use the GNCs for the facilitators, we can enhance the experience of those students. And so University of Sunshine Coast is a co-applicant on that tender. The other spin-off from the programme is the shortages in aged care. Some organisations are paying recruitment agencies to go overseas and bring nurses to Australia. Now, our International Congress of Nurses has said that that's not a good plan, and in fact, it's unethical for the brain drain. You know, so the shortages then happen in those countries, but it is happening. So in Warrigal, they were telling me about the number of overseas educated nurses who were coming to Australia. And they told me they were going to allocate these nurses to the care homes where the shortages were worse. I said, oh my goodness, what on earth are you thinking? I said, that's such a high risk situation. You know, you're going to pay all this money. Well, they'll all sorts of things, but they're not going to stay. Anyway, we had a long conversation. So what Warrigal did, they put a call out for their team members to become mentors. So they were inundated by expressions of interest. So now they have this big pool of mentors, and their mentors are supporting those overseas educated nurses. So fingers crossed, we don't know, that's only just happening now, but hopefully that has an impact. And when I talk to other industry partners, I'm explaining this initiative. So we're hoping that that takes off. So Baptist Care have asked whether we can deliver this program to them. And of course, we have to shout about the awards and recognition. In our team, when we were all face to face, we had a little bell and we'd ring the bell when something happened. But some of these are bigger than little bell moments, really. We got Best Talent Development Program. So we use Open Learning, which is an online platform for the course that we developed. And it's just terrific. Anyway, we won a prize, so we were very excited about that, an international prize. The funding that has enabled us to keep delivering the course is from the Department of Health and Aged Care. So we had a first tender in 2021, and we've just been refunded, so we'll go until 2027, and that's where the team have been able to have their contracts extended. And the Council of Deans of Nursing and Midwifery gave us a commendation for the work we were doing. So what's next? So my role as Professor of Dementia in Warrigal, which I do 2 days a week and 3 days a week as the Professor of Healthy Aging, I wrote my dementia action plan for them and, identified all the areas for development. And they asked me to say, give them the wish list, the minimum. And they've supported me to create the dementia care competencies course for all their clinical nurse specialists across all their care communities. So where it's a small care community, one small nursing home, there'll be one dementia nurse specialist who becomes one clinical nurse specialist who becomes a dementia specialist. The larger homes will have 2, maybe up to 3 clinical nurse specialists becoming dementia specialists, because this is the core work of aged care. The data that the government's publishing doesn't match the reality. So Nina and Stephen are actually working on a dementia recognition project, and they're doing some data mining with Warrigal's e-health records, because probably 70% of older people being cared for in nursing homes have a dementia, and that's the only ones that are recognised. So dementia's core work. And another challenge that has, I think, risen with the demographics. So older men are aging now. So in the past, care homes would have been, mostly older women. And if they had dementia, you might, what did we used to say? Or John Rosenberg called it dotty to yesterday. He was telling us that bad word, or it was pleasantly confused or whatever. But now these gentlemen, they're going into nursing homes, they've got dementia, and they're really active. They need to be outside, and they get frustrated, and the way their dementia presents itself is really challenging. It's so difficult for the care staff, and they do get aggressive. And then the other little gentleman, could be this big, he's trying to save the nurse, and so we really do need to improve dementia care. Another initiative that is a primary health network is supporting general practice to pay the general practice to release practice nurses to actually do the gerontological nursing competencies course, and then the mentor that we'll provide to them will support them do quality improvement initiative the following 6 months. So the course is 6 months. They'll then do a quality project around healthy aging. And this is huge because practice nurses probably have less access to professional development than even aged care providers because of the small business model. We have a PhD candidate developing level 3 for the GNCs. I've just called it level 3 because we don't know what the word will be used, whether it's expert or whatever, advanced, whatever the word will be used, but she's doing that, and she's done focus groups, and she'll do a Delphi. We continue to evaluate the impact of the competencies, and that's the advantage of having the tender, that we can do that. And I just want to finish with a clinical professor with Warrigal, still a unicorn. There's only 2 of us in Australia. And this is Auntie Millie Ingram, who was Female Elder of the Year in 2024. I would just like to pose a question to everybody listening before we finish today, and ask, what does your future old age look like? And this is Mr. Kim Collard, who was Male Elder of the Year 2024.